One of the first items that I would share with my clients who were caregivers and that I used in my family, specifically with my father-in-law, advance directive. That is documented in power of attorney, power of medical attorney. Who makes the decision when you say, is it time? Is it his desire to pull the plug? Making sure that you have the conversation before it's too late to have the conversation. Because when it's too late to have the conversation, you don't need to be sitting there saying, I wish I could have done it this way.
Then as a physician, having an advance directive for patients is so key, especially in unpredictable or emergency situations. It answers some very specific questions for providers and medical teams when it comes to patients. So if someone's heart were to stop, do you want the medical team to essentially do cardiopulmonary resuscitation or CPR to try to restart the heart? That is a very personal decision for people. Sometimes when someone's heart stops and we do CPR, we are blessed to be able to restart the heart rhythm and other things, and then sometimes we're not. And so a lot of times that decision comes from how healthy is someone at baseline. For someone who's very, very ill, the chances of bringing their heart back into a normal rhythm and them having normal function after that event is very low. And so that's one of those very difficult but very necessary conversations.
If your loved one is going to get CPR and they're already frail, then you would have to understand, is that CPR going to crush the
ribs, right?
You know, are we going to actually cause more pain?
Yes, right.
And is that our choice to make?
Right.
It's not our choice to make.
No.
So have the conversation when an individual can tell you, I would rather you just let me be.
Right.
Many of us think, you know, well, that's a legal thing, so I don't need to have anything to do with that. There are very easy ways, mechanisms to do that. Many healthcare organizations now within those portals that you mentioned will have a legal option where you can at minimum go in and you can read that information. But it's no excuse now.
Right.
Get what you need and make sure that you have what's necessary.
Right.
And that's the paperwork with signature on it.